Hello, my name is Patrick Brown, Mayor of the great city of Brampton. I'm joined today by Paul Morrison, our Director of Bylaw Enforcement and Legislative Services, along with Dr. Lawrence Loh, who is our Medical Officer of Health in Peel Region. And this is our weekly COVID-19 update on the efforts that we're undertaking in Brampton and Peel Region. Before I get into COVID, I just want to mention that last week was a great week for municipalities. Obviously, on Wednesday, the Government of Canada announced a $15 billion fund for public transit over 8 years, and we know there's some exciting projects in Brampton that will certainly, we hope, be part of that federal rollout of infrastructure funding for transit. And just on Friday, we had a meeting of big city mayors of Canada, and we are having a very positive conversation with the Government of Canada on the continuation of the Safe Restart Agreement. So the first Safe Restart Agreement was in 2020, and it was for shortfalls related to COVID, public health funding, transit funding, frontline municipal workers that are really unsung pandemic heroes. That funding took us till December 31st, and we're continuing the conversation with the Government of Canada and the Province of Ontario to make sure that funding is in place for 2021. The last thing we can afford right now is to have those critical frontline budgets be empty in 2021 when we know the work of public health and other frontline municipal workers. That funding needs to be available because we're still in the mix of this pandemic. The first thing I wanted to underline today is, there's lots of optimism. Kids are back in school where they should be learning, and today's the first day in Peel Region that we have students back in school. Obviously, yesterday, due to the snowstorm, it was delayed. And as much as there's lots of optimism, there are some concerns that it's important to pay attention to. And we had this conversation with GTHA mayors yesterday and with public health. Peel Region is seeing more reports of variants of concern in our community, particularly in Mississauga. As of today, Peel Public Health is aware of 45 cases with confirmed variants of concern, with 200 pending confirmation. 5 of the confirmed variants are B1351 South African origin. The other confirmed cases are the B117 UK origin, and these variants are obviously of significant concern. Although the overall numbers remain low, and you're seeing the COVID case counts decline, which is great news, the variants are becoming more of concern, and so we can't let up. We're going to need the public to continue to be diligent because the growth of variants in Peel Region is something that is alarming, unfortunately. And as Dr. Loh has said, and you're going to hear from him later today, the reopening of our community and businesses, it's critical that we don't have threats. And if variants are spreading at a significant rate, it will hamper our ability to have the reopening of our economy. And I'll leave it for him to speak to that in greater detail. In terms of compliance with the public health guidelines, we continue to see great compliance. And I was a little bit worried. It was Family Day weekend. Sometimes with a long weekend, you're going to see more of a relaxed approach to the public health guidelines. And we saw that in some of the long weekends over the last year. It wasn't the case this weekend. There was only 5 charges under the Emergency Management and Civil Protection Act, only 11 charges under the Reopening of Ontario Act. So thank you, Brampton, for your high level of compliance and taking the advice of public health to heart. In terms of a hospital update, with the Osler Health System, I've got an update from Dr. Naveed Mohammed, and he wanted to share that Osler, throughout their sites, has performed 359,000 COVID-19 tests. In terms of their current capacity, there are 24 COVID-19 inpatients at Brampton Civic Hospital, 4 of which are in ICU, and a further 14 COVID-19 suspects are awaiting results. And so that's encouraging as well. The fact that we're starting to get more hospital capacity is another positive sign. But we'll hear more from Dr. Loh on why we still need to be diligent. So on that note, Dr. Lawrence Loh.
Thank you, Mr. Mayor, and good morning. This week, Brampton's test positivity sits at 7.7%, which is flat from 7.9% last week. with a weekly incidence rate of 137.2 per 100,000, which is only slightly down from 155 per 100,000 cases last week. Our rate of decline has started to slow, and the stabilization that had been taking place in our hospitals has also started to plateau. This leaves our situation very precarious, as it appears overall trends in our community are being driven by two underlying patterns going in different directions. The original COVID-19 strains identified in our community continue to decline, which is favorable, but the variants of concern are accelerating in growth. And as Mayor Brown identified, over the last week, we have gone, just in 7 days, from 5 reported cases of variants of concern to 45, with over 200 additional cases that have screened positive. The screening test is highly accurate, so it's almost certain that all 200 of those could be confirmed as a variant of concern shortly. While some of this is explained by increasing screening by our provincial laboratory partners, our investigation into variant clusters in our region have identified additional concerning findings. We have confirmed that the variants appear to be more transmissible, seemingly linked to much shorter interactions, as opposed to the typical close contact that is needed to transmit the original strain. While we are grateful and glad that all of the long-term care residents in our region have now been offered 2 doses of vaccine, we are still largely unvaccinated as a community, and many in our community remain vulnerable. This means that opening too quickly risks another surge of cases, hospitalizations, and deaths, just as vaccines are on the way. On that, the province has signaled that we will see more vaccine in the coming weeks. As soon as we get supply, Peel Public Health will work with our partners to restart vaccination for our highest risk healthcare workers, which are providers in long-term care and in the emergency room, on COVID wards, and ICU, etc. I'm also excited to hear that allocation is coming for our seniors over 80 plus. I know that they have been very patient, and once that allocation arrives, we will work quickly with our partners to deploy those doses. I'm also glad that our children are back in school today. The precautions taken in those settings will help them derive the significant benefits of in-person learning and keep variants out of that setting. However, keeping kids in school and avoiding another lockdown means we must also keep our community cases under control. With the variants here and growing, I see 2 ways forward in the next 2 weeks. Can we reassess our anticipated return to the provincial framework? Holding the status quo for just 1 incubation period, 14 days, will allow us to better see where the variant trends go and review any impact that school reopening might have on community contacts and transmission. Failing which, if we are to return to the provincial framework as of next week, then I ask that we finally address the issues facing our essential workforce. Blitzes, rapid testing, paid sick days and protections for temporary and contract workers. We've said this for months, and that is the balance that we must target if we are going to return to the provincial framework as of next week. Simply put, more testing and isolation centers are no good if you can't take time off work to use them. I know everyone is tired, but I also know that we can't afford a 3rd wave and a painful lockdown. So the next few weeks are crucial for our kids, for our businesses, for the success of our vaccination program, and for the most vulnerable among us, as they have always been. Help is on the way, vaccine, spring weather, and so we really need to make sure we get this right. And no matter what gets announced in the next few weeks, I ask our residents to continue doing the tremendous work they've been doing in holding the line, staying home as much as possible, and beating back COVID-19. Thank you, and I'll pass it back to Mayor Brown.
Thank you, Dr. Lowe, and now we're happy to take some questions. Graham Frist from the Brampton Guardian first.
Good morning, guys. How's it going? First question is for Dr. Lowe. Dr. Lowe, it doesn't sound like you're very optimistic about us opening up in the next week or sort of easing restrictions the next week. I'm just wondering what some of your concerns are, and are you recommending that we stay in lockdown?
Thanks very much, Graham, for the opportunity to clarify. The recent condominium cluster in Mississauga, as well as some additional clusters of variants of concern that we're exploring in our community, are certainly in the back of my mind when we are moving forward. As I mentioned, we are seeing a significant growth in the variants that are being detected in our community. And I know it's not news that people want to hear, but I think just holding on for a couple more weeks will allow us to really figure out what the picture is, to try to get things under control, to try to make sure that the school reopening goes off without a hitch. So I've certainly laid out 2 recommendations. So ideally, if we could try to pause and hold the status quo, that would be ideal. However, in the event that we are unable to do so, then I really ask that we sort out the situation with our essential workers. That problem hasn't gone away. Thanks for the question.
Okay. My follow-up would be for Dr. Lowe as well. Now, I guess a couple of weeks ago, it wasn't particularly clear that the vaccine worked on the South African variant. Are we seeing any? Has there been any update on that? Is it effective or is it showing any effectiveness for the new variant, the South African one?
Thanks for the question, Graham. Actually, the 2 approved products in Canada are not known to have any issues in addressing the B1351 variant that was originally detected in South Africa. There are questions of its effectiveness in moderate and severe illness for the AstraZeneca vaccine, which is currently still under review with Health Canada. And I imagine when that vaccine, the AstraZeneca vaccine, is vaccinated, we will receive guidance from our federal partners as to how best to deploy that vaccine in our community. Thanks for the question.
Okay, Irene from 680 News.
Good morning. My question is about vaccines. So once you get the doses, are there plans for mass vaccination sites?
So, and Dr. Lowe may want to speak to this as well, but we're ready. It's all about vaccine supply. The sites have been identified, the modes of vaccinations have been identified, and I have to implore, we need supply. And it's frustrating in Canada that we don't have adequate supply right now. I want to see our residents vaccinated, and I turn on the news and see the numbers being vaccinated in other countries like the UK or the US or the UAE or Israel, and it makes you envious. And I hope that supply, which has been very slow in coming, that we're going to see that expedited. And I'm sure the Government of Canada is hearing that daily in the House of Commons, but the supply needs to increase. And there'll be no delay on a local level in terms of our ability to make sure those in need get the vaccine. You know, that's been ready for months.
My follow-up is to Dr. Lowe about the variants and the clusters that we're seeing. If they can spread so easily in a condo, can't the same be said for school where people are sitting next to each other for hours?
Thanks so much for the question, Irene. No, they're fundamentally different because, as you know, in a condominium situation, and especially when people get home, there's a tendency to perhaps let measures slip. At least in our investigation, there's a question around whether mask use was consistent in common areas like elevators, corridors, etc. As you know, with schools, there are a number of enhanced precautions that have been put into place, and there is also automatic dismissal and asymptomatic testing, which act as early warning triggers to make sure that we're able to stay ahead of this. So the school setting is certainly very protected and very controlled to the best of our ability. And honestly, the best way we can protect our school setting is to keep our community levels of transmission down so that there is an introduction into the school setting in the first place. So thank you very much for the question.
Okay, thank you, Irene. Our next question is Nikita from the Bramptonist.
Good morning. My question is regarding administration of the vaccine. How does Region of Peel Public Health propose to administer the vaccine to seniors at home who have mobility issues?
Okay, I'll have Dr. Lowe speak to that.
Thanks very much for this question. We are absolutely aware of our seniors at home that have mobility issues. Part of the challenge is with the authorized products at this point in time, both the storage and the handling required there too. But we are working very closely with our transportation partners across the region, as well as our primary care partners, to really figure out if there's a way, perhaps either through home visits or through other means, to actually get them to vaccination sites and centers. I think that's where our home care partners within the healthcare sector, we continue to explore, and we will certainly have an answer, at least to make sure that those seniors can also be vaccinated, recognizing their risk. Thanks very much for the question.
Okay, our next question is Nitin Chopra from Prime Asia TV.
Good morning. My first question is to Dr. Lowe. Dr. Lowe, now the Ontario is seeing more than 300 variants of all these three kinds. How effective is the Moderna, Pfizer, and AstraZeneca vaccine against these variants? If it is effective, then how effective? Because some countries report, we are reading that their vaccines are not effective against those. What is the condition here in Canada?
So thanks, Nitin. Just to repeat again my answer to Graham, the AstraZeneca vaccine, which is currently in process of being reviewed by Health Canada, has had questions around its effectiveness against the 1351 variant specifically in South Africa. There is no indication of any issues with the two approved products in Canada, to my understanding. Certainly, if there are any changes around that, our federal partners would advise through the National Advisory Committee for Immunization. Thanks very much.
Thank you. My follow-up is for Mayor Brown. Mayor, for the university in Brampton, we got a reply from the province that they are awaiting a project report or a proposal from City of Brampton. They said only a submission and the formal talks are going on. Your words on that? Also, the councillor is bringing a motion in the city today for reduction of the auto insurance. What do you have to say on both these subjects?
So on the issue of Brampton University, the discussions with the province continue to go well. We've had two different submissions, and we continue to get closer to the pathway that would lead to Brampton finally having our own post-secondary infrastructure, and so I'll leave that to the province to determine of when that's going to be announced. But I would just say that the conversations have been very positive so far. In terms of the auto insurance motion from Councillor Dillon, I support it. I certainly think it's unfair that Brampton pays some of the highest auto insurance rates in the country. And when I was in the provincial legislature, I advocated to end postal code discrimination. The fact that insurance companies can have these surcharges based on where people live doesn't seem fair, and I do hope that it's going to be revisited. It's regulated at provincial level, but I will support Councillor Dillon's advocacy on insurance rates. We have time for one more question, so we'll go to in Brampton, Steve Picard from in Brampton. Steve from in Brampton, can you hear us?
Yes. Question for Dr. Lowe?
Thanks, Steve. Go ahead.
Hello?
Hi, Steve.
Oh, hi, Dr. Lowe. Yes, as far as the outbreak at Mississauga condominium, can you say how many people were tested and if more cases of variant were found?
Yeah, thanks very much, Steve. At this time, the results are still coming back in, and it will take some time to integrate it into our investigation and analysis. But I understand that our provincial laboratory partners tested over 500 residents. Quite a number of residents were actually not in the condo at the time, and so they have also been advised through a letter that they should get tested at an assessment center, so those numbers may continue to rise. Thanks for the question.
Time to ask another?
Sorry, is there a follow-up question, Steve?
Yes, for the mayor.
Yes.
Yesterday, the Prime Minister said that he'd give municipalities the authority to ban handguns. I know the province could still stop that, but do you think the City of Brampton will move to ban handguns?
So I'm waiting to see the details from that announcement. I only saw the news coverage. Having said that, in principle, I support more gun control. The less guns in our community, the better. And if there are avenues available to reduce the number of firearms within an urban environment, I would obviously be supportive. We've struggled with gun and gang crime across the GTA, and any tool that's put on the table that will help us reduce the number of guns in our community would be a welcome one. But once again, we'll await the details on what the municipal role is in this and what mechanisms the federal government is offering. So that covers our COVID-19 briefing today. I've got to go to our City Council meeting that's about to start in a few minutes, but thank you for tuning in. And as always, stay safe and listen to the advice of Peel Public Health.